Ladies and gentlemen, good morning from Manila and very good evening, late good evening from Toronto, Canada. COVID-19 has changed the order of the world. It deeply affects the sustainability and very existence of a global society as we know it. The health and human toll now combined with the economic damage is a double-edged sword, represents the largest economic shock the world has experienced in decades and has now grown to 3 times of the last shock of the financial crisis. For emerging markets and developing countries, specifically the Asian, many of which are facing the worst of the crisis, sadly, in spite of huge government efforts, most countries are expected to face some levels of recessions in 2020. Economic growth in Asia and Pacific will fall from 5.5% to 2.2%, a global loss of more than 100 million jobs and 2.7 trillion in revenue due to COVID-19 related restrictions. The Asia and Pacific region alone stands to lose approximately 63 million jobs and 1 trillion in GDP. Asian Development Bank, headquartered out of Manila, has some 31, I think had 31 members at its establishment in 1966 and has now grown to encompass 68 members. And as a financial institution that is Asian in character and foster economic growth and cooperation in one of the poorest regions in the world. And in spite of many initiatives, it remains a region home to a large share of the world's poor. 263 million living on less than 1.90 a day dollar and 1.1 billion on less than dollars 3.20 a day. With such standards of its direct beneficiaries, naturally the bank finds itself in the middle of unprecedented crisis. It is an honor for me to welcome to World Tourism Forum Institute Recovery Townhall, Dr. Patrick Osewe, Chief of the Health Sector Group and Asian Development Bank. Welcome to our platform.
Thank you very much, Sumaira.
Let's get started. It's clear tourism is the worst hit sector. We are currently experiencing the shock as the worst is not behind us. We have been exposed such as on our reliance on tourism to drive profits, a lack of tools to address the shock, for example, access to credit and good governance, reliance on for international volumes, and small businesses being wiped off forever. ADB is such a strong organization in Asia responding to COVID-19. So what is your perspective on the current situation and how is your organization stepping up the efforts to fight this mammoth crisis?
Thank you very much, Sumaira. So the COVID-19 is primarily a health crisis that is affecting all sectors of economy. So that's we as a development bank, we have 68 members and 48 of those members are developing member nations. If you look at Asia and the Pacific over the last 60 years, there's been significant economic growth, and the life expectancy has increased, the levels of education has increased, and so the region before COVID was doing quite well. And then now, of course, COVID has become the biggest challenge that the region has faced in more than 100 years. We've had a few pandemics over the past 20 years, but this is the worst one. And because it's affecting all sectors, we are finding that it's erasing some of the development gains that our countries have had in the past. And the Asia Pacific, but of the 48 developing member nations, 12 of them, the tourism constitute more than 10% of employment. So the share of employment of tourism in many of our countries is quite significant. And in a few countries, like for example, Vanuatu, Fiji, Cambodia, Georgia, and so on, it constitutes over 20% of the employment. So this crisis is really affecting our developing member countries, and so we are doing all we can to try and support countries by providing financial support, technical assistance, and bringing in the best knowledge there is to try and deal with some of these issues.
Okay, so Thank you for that very comprehensive introduction. In the Asia and Pacific region, which is what the bank covers, in particular, travel and tourism are linked to the economic well-being of the, as you said, in some countries, it's even 20% of the employment. The industry accounts for as much as 80% of the GDP in some countries. I believe Asian Development Bank is supporting its developing members through finance and knowledge and partnerships. How is your organization responding to support the cooperation and collaborations?
So because this is a new pandemic and the virus is a new virus that we were not familiar with, there's been major challenges in terms of first understanding what is the nature of this disease, and secondly, how is it behaving in society. In many pandemics that have occurred in the past, like for example, the SARS epidemic in 2003, or the H1N1, or the Ebola more localized epidemic in Africa, and so on. Sometimes it's not a new pandemic; it's something that is known. But this was a new one. We didn't know how it was spreading, whether it was only affecting the elderly or as well as the younger population, how it was. What was the best way to diagnose it? What was the best way to treat it? There was basically no treatment. And so we faced a serious challenge on how to deal with this virus. And because countries also didn't know how to respond, they responded very quickly by locking down economies. So you had a situation whereby in almost all parts of the world, countries were locking up, the education sector collapsed, the retail sector collapsed, literally all sectors collapsed. And because of that, it's negatively affected the economies. And right now we're trying to get out of there. Some of the countries are opening up. And specifically for tourism, for instance, Maldives opened up on the 15th of July. Before the 15th of July, Maldives, since the pandemic, had reported just about 700 cases, around 700 cases. But since from the 15th of July to the 15th of August, they've reported 2,800 cases at least. And so you're seeing that in a very short period that they've opened up, the number of cases have increased by 400%. So this is a big challenge that countries are facing. You know, Maldives is also, the economy is driven by tourism. And so the balance between livelihood and economy and health. And so how do you go about opening the economy in a way that it's responsible, but at the same time ensuring that you protect people's health? So that is what we are doing in many countries. In Vietnam, for instance, a country that suffered from the first pandemic in 2009, the H1N1 pandemic, which you call bird flu, and they have a very good system in place of detecting and tracing and quarantining people and so on. And Vietnam did not have a death until recently, where now we see that because they opened up for domestic tourism only, not international, but domestic tourism. And the disease is now beginning to spread across the country and so on. So we have significant challenges to deal with, and how do you ensure that we continue to support countries, provide the knowledge, provide the financing, and at the same time ensuring that the disease is not spreading.
Right. And what sort of partnerships you're looking for? I mean, the bank obviously cannot operate in its silo. You know, you do need partners on the ground, non-financial partners, you know. So what are those kind of organizations that you are tapping and tying up with?
So we are collaborating at the country level, basically bringing sectors together to have a conversation on how they can address some of these issues. And so we bring the tourism sector, the transport sector, which of course then include the aviation sector. Where we include the sector that's responsible for hotels. Sometimes that falls under the Ministry of Tourism, sometimes falls under a different sector. And so we basically what we try to do is to bring everybody, the airport authorities, because the airports play a very central role in ensuring that people don't get infected, the airlines and all the other related sectors. We also, for instance, we are working with the International Civil Aviation Organization. This is a UN agency specialized for aviation. We are working with the Airport Council International because this is the entity that's responsible for oversees the operations of all airports globally as a membership. We are working closely with the IATA, which is a membership of all the airlines. We are working with some of the biggest hotels like the Hilton, the Marriott's, and so on. So we are trying to bring everybody together to brainstorm and say, what's the best way to deal with travel and tourism? And looking basically for a customer's journey from your home through the airport into the airline and up to where you are going, and ensuring that that whole journey is safe, and therefore the passengers have confidence that they can actually go on business, and they can also go on tourism as a vacation. And of course, we are also collaborating with the World Health Organization. We are collaborating with the ministries of health and various ministries. So this has been a big tent to bring everybody together. For the first time, we have established partnerships that didn't exist before, or people that never talked to each other before, because we are all trying to solve a common problem: how to jumpstart and reboot the economies, and particularly the tourism and travel sector.
Thank you. Okay. So the WHO says the risk of sliding back into coronavirus lockdowns is very real without a careful staged lift approach. Each country is at different levels of opening up, adapting to a new normal with varying degrees of caution. But such reopenings, if done too quickly or carelessly, could easily prompt a virus rebound. The question is not if there will be a second wave. A second wave is already upon us, hitting countries which were first to experience early wins, being declared almost virus-free. Now they find themselves in the middle of a resurgence. What strategies is the bank applying to help these countries curb this? Because some of these incidents are happening as we speak.
So this is the biggest challenge that countries are facing. If you look at the past 10 pandemics over the last 100 years, it was very clear. Some of them started in the northern hemisphere winter and ended in the spring. Many of them behave like that.
Right.
A few of them started from the spring and ended up in the summer. This is the first pandemic that we are seeing that started from the North American winter, has gone through the whole winter, the whole spring, and now through the summer. It's behaving very different than any other pandemic, any other virus that we've seen. And therefore, it's usually very difficult to predict. Now, the second wave, it's the biggest challenge for most countries, because the planning was that this would last perhaps the longest 6 months. But now we are seeing that in countries with very strong health systems, we were very, very surprised when we saw that in Melbourne and the state of Victoria, that has 25% of the Australian population, there was a significant transmission, basically the second wave that led to the lockdown of 25% of the Australian population. Now we are seeing the same happening in Korea, whereby from one particular church, the disease is spreading across Korea. Korea is one of those countries that right from the beginning had very, very good policies and interventions to deal with the COVID-19, and Korea actually never closed down before because of the preparedness that they had. Vietnam, that never had any death until just about a few weeks ago, is a country that is not a very not a very rich country, but because of the previous pandemics, they're very well prepared, and we are seeing a surge of infection there. So this is our biggest challenge, and we are brainstorming with countries to see how we can support them financially. We are bringing knowledge. We are bringing countries that have gone through second wave to share their expertise with the other countries, so that what is that they should watch for to ensure that that this does not happen. We bring some of the best communication companies in the world to work here in our region, support our countries, some of the best technical agencies in the world to come and support our technical teams. We are working with a variety of national interagency task forces that are dealing with the virus, providing them technical assistance to ensure that they keep the virus in check, but sometimes it takes everybody by surprise because in New Zealand, whereby we didn't think that there would be a problem, it's a small country, very strong public health systems and so on, and we see that there's now the resurgence of infection also in New Zealand.
Yeah, right. And in Korea, I believe that now the new strain that is coming through is untraceable or untrackable. It's a absolutely new strain. So yes, we are dealing with an unknown animal. Let's just put it this way. So ADB, Asian Development Bank, launched an operational plan for health from 2015 to 2020. And this was launched in June 2015. The plan describes how ADB would support developing member countries in achieving universal health coverage. Key priorities are in investing in health infrastructure, health governance, and financing. Pretty straightforward. However, fast forward to 2020 and COVID happens. No one would have imagined how the last leg of the plan would end up. Talk to us about how ADB is financing response activities to the pandemic, ensuring supply chain for essential medical supplies, and at the same time, enhancing testing capacities in these countries.
So our thrust as an organization is to support universal health coverage. So for universal health coverage, you basically have three dimensions. First is to ensure that you have coverage, you have primary care clinics across the entire country, and that those clinics have the relevant staff and also the technology that is required and so on. So that if there's a problem, you can actually pick it up at that particular level before it spreads into a much wider community and so on. So a very strong primary care is very paramount to deal with pandemics. And that's what we have seen, for example, in the Mekong sub-region. The countries with ADB support and other support from the government and other development partners, they've had a very good system in place to pick up the diseases as they come up and so on. So primary care is a big part of what you're doing. The second part of the universal health coverage is to ensure that once you have all those clinics, the staff, the technology, that the quality is the right quality so that there are no mistakes being made. And the third part is to ensure that people have insurance or financial coverage, because usually the biggest challenge is that sometimes you have health facilities, but people cannot afford it. So how do you ensure that people are not plunged into poverty because they do not have health money to go to us to seek to get services and so on. So this is our thrust. So we are working with countries, we are providing financing, we are providing technical assistance. We are bringing a lot of knowledge. There's a lot of knowledge sharing across and between countries and within countries, engaging the private sector to ensure that people get the help that they need so that they can live longer. We're also facing a challenge in our region. Some parts of our region, like Southeast Asia and East Asia, the population is growing older. The average life expectancy is somewhere between 73 to 75 years old, and which is great progress and great development. But then the challenge is that the older we grow, the more chronic illnesses we have, and the more expensive illnesses that we have. Because for infectious diseases, if you have malaria or TB, you get a course of treatment and then you recover. If you have diabetes or you have hypertension and other cardiovascular problems, you'll be seeing a doctor for many years to go. So it becomes really expensive. So we are engaging with countries to see how we can address the issue of chronic illnesses by screening at a very early stage and dealing with those problems to avoid some of the complications that we face as we grow older. So ADB is a major partner for many countries and health, but we also collaborate with the World Bank. We collaborate with other financing institutions to ensure that we look at the financing in a country together, not necessarily as silo organizations and so on. So on that note, we are organizing a meeting on the 17th of September that will bring together ministers of finance and ministers of health and some of the key partners that we work with to begin to address this issue. How do we support universal health coverage as a foundation for strong health system, and therefore to be able to avoid the next pandemic or next side of COVID as it arises. So a lot of discussions going on, a lot of collaboration, a lot of knowledge sharing to ensure that we are on top and ahead of the virus instead of being behind it.
Let me push you a little bit further on this. Okay, this is all good talk. This is all very good. The world needs to hear about it. But today, with this pandemic, they're saying the only resolution will be through a vaccine. Tell me, share with me, what are your efforts in making that a reality?
So because COVID is a new virus, a vaccine did not exist. Because the impact is so serious, there's a lot of work going on to try and discover the vaccine than any other disease in history. And so currently there are about more than 165 vaccines that are under trial. And of those, about 27 are under clinical trials. So, you have to do the preclinical trial in the laboratory and so on, and then you start doing clinical trial with the human subjects and so on. So we have over 27 vaccines. The numbers keep changing every day. So there are two issues around vaccines that I think that your viewers should know about. The first is that how can countries obtain the vaccine? This is because there's so much research going on, but then the fear is that the rich countries will get the vaccine and the poor countries will be left behind. So because of that, the global community, the World Health Organization, the Gavi Vaccine Alliance, and the Coalition for Emergency Preparedness and Innovation so it's a Coalition for Epidemic Preparedness and Innovation, CEPI. So the three organizations have come together to establish what we call the COVAX facility, COVAX, COVAX facility. And this is a facility that is financing some of the new vaccines. So about 5 to 10 vaccines are being financed. They're raising about $2 billion to support the financing of the vaccines. And the vaccines that will be funded, that will be discovered through COVAX, will be subsidized vaccines for low and middle income countries. So that's how it's being approached at the global level. And then once the vaccines are discovered, the first group of people to benefit will be health workers and people with vulnerable diseases, and then progressively being increased in communities and so on. Of course, that does not stop countries to get vaccines directly from some of the manufacturers, but the challenge would be that there'll be competition. If one company discovers a vaccine and there are 20 countries trying to get vaccines from that company, it becomes a big challenge. So obtaining the vaccine, COVAX facility and pharmaceutical companies are doing a lot of work to ensure that the vaccines are available. So that is the first big issue. The second big issue is at the country level. How do we prepare the countries for a new vaccine that has not existed before? The current vaccines are mostly for children and teenagers. This is a vaccine mostly for the elderly and the adult population and so on. So the first issue is, if you have vaccines in the country and you don't have enough, you need a strategy in place to be able to define how you're going to roll out the vaccine. Who gets the vaccine first? How are you going to execute a plan to implement that, particularly since it's new, you have to train health workers and so on, and how are you going to finance it? That's this is a top issue that you have to think about. Once you think about all that, then the supply chain, is the country going to use the existing supply chain? If it works well, it's mostly for children, and they put this on top of that, or is it a separate supply chain? And then once you have the supply chain in place and now your vaccines in the country, because the demand for vaccines is going to be so significant, you might have several vaccines in one country. So if you do that, you need a system in place to be able to monitor how the vaccine is performing. Some of the old traditional vaccines have been in existence for a long time, and we know how they perform. This will be new. So very clear agenda of monitoring how it's performing in the community. There are vaccine accidents whereby some people might, for a variety of reasons, might die, or there's adverse outcome out of this vaccine. So you need to monitor all that. And then lastly is the issue of communication. There are many people who feel that the way that the vaccine, the way that the politicians are engaged in discussions around vaccines, that maybe some countries are cutting corners to get a vaccine quickly. And because of that, there are people who feel that they don't want that, they don't want a vaccine. There has to be a very sustained communication to educate people that the only way to open up the economies and to avoid any future waves and so on is to have a critical mass of people vaccinated so that there's immunity in the community to keep the virus in check. So lots of challenges as ADB. We are currently engaging our developing member states on the process of how we can support them to develop the various strategies, the costing that is required, the supply chain that's required to be able to get ready so that when the first vaccine is available towards the end of the year or early next year as projected right now, they are ready to deliver the vaccine to the populations and so on. We don't want to be caught off guard the way we were caught off guard with personal protective equipment in February and March, whereby they didn't exist, countries were demanding them, health workers did not have the PPEs, and therefore there's a big crisis in many countries, including some of the advanced countries and so on. So we want to avoid that by engaging right now. We are talking to the Gates Foundation, we are talking to various, we are also talking directly to some of the pharmaceutical companies just to ask their perspective of how we can engage with them in the event that how countries can engage with them in the event that there are not sufficient vaccines through the COVAX facility, for example.
Thank you. I didn't want to interrupt you, Doctor, because I think this is one of the most important questions I've asked on all of our town halls, you know, and you've given such a comprehensive response to our viewers, especially for laymen, people who are not from health sector, and ordinary people who are worried, you know, that who are the drivers of this process. So it's really heartening to hear about all of the good work that your organization and yourself personally you are putting in there. Just moving on, you know, anything else I ask is very insignificant, but it's still important that what is your advice for tourism enterprises to safely restart their businesses in this pandemic era? Because COVID-19 will change the way we travel forever. However, defining international guidelines has not been easy for any organization and individuals. So please share your advice here.
So this, to reboot the economy requires participation of several sectors. Because people are scared that they might get infected during their journey or at the destination and so on. So the ministries of health or the Department of Health have to take a very strong leadership collaborating with the tourism sector to ensure that the testing capacity is strengthened and that people can get testing as quickly as they can. For instance, if you go to a country X, and it's a requirement when you go back to your country or to another destination that you have a valid COVID test. It should be something that's easy to get. You can walk in and get your COVID test either on the same day or the following day. Right now, in many countries, it still takes about 5 days, 7 days, and so on. And so the case in point, in a country like Kenya, for instance, you need a COVID test that was done within 96 hours. Now, if it takes 7 days somewhere else, then there's just no way you can go and be a tourist in Kenya, for instance. Or if you want to go to another country in our region, this is very consistent across many countries. So collaboration between the ministries of health, the Ministry of Tourism, and other relevant authorities to make testing available quite central. And we as ADB, we are working with countries to build their testing capacity, supporting the private sector, supporting the public sector to ensure that the testing capacity is strengthened. The second part is that sectors must work as a team because in tourism, other than the airlines and the hotels, there's a whole other players who are mostly small and medium enterprise entities. And so if you go on, here in the Philippines, for example, in some of our top tourist destinations, you want to go and do island hopping. And so you need a boat to take you to various islands, and so it's beautiful. But these boats, they're owned by individuals or by small companies and so on. So a whole process of work with government, working closely with the smaller players in the tourism sector, accrediting them so that if a tourist is staying in a hotel and wants to go island hopping, for instance, they know that these are the pieces that have been accredited, they've been trained, they have masks, they have social distancing measures in place, and so on. So that collaboration and that coordination to ensure that this collaboration is extremely important. And then the second part is to look at issues of how we can use technology to avoid transmission and to avoid infection and so on. And many countries now, in Singapore, in Australia, and some of our member countries, there's a lot of technology that's being used either for contact tracing, so for quarantine, and also to touchless technology to ensure that you do not expose yourself to infection. And then the third is to look at issues of sanitation. You know, there's a lot of PPEs that are being generated. What do you do with the PPEs? This is a challenge that we are facing with plastic bottles in the environmental field and so on. How do you deal with all that? So I think those are the issues that that coordination, collaboration across various sectors is extremely important, and also for the ministries to work with the industry to ensure that we are all trying to have a common agenda to restart the tourism sector.
Thank you. And which geographies, and I'll just push you a little bit further on this, and I know that you don't have a crystal ball in front of you, but just based on ADB's health and hygiene, safety conditions data, your current data and assessments, which regions do you see recovering first in the geographies you operate in?
So this is a very difficult question because when the pandemic started, in our region, mostly started, it was a problem in East Asia. So in People's Republic of China, and then Korea, and then from Korea, Iran was the next country, and then it went to Europe. So we more or less felt that perhaps the problem had shifted from our region to the European region. And then the problem came back, and we started having severe problems in many of our countries, and so on. So currently, our biggest challenge is in India, because India had the longest lockdown. This is the second most populous country on earth. The longest and the most strict lockdown for almost 2 months, and the virus was in check. But economically, it was a very big challenge for such a large population and so on. So they opened up, and the disease started spreading, and now India, the data of yesterday, they reported 65,000 cases, so much higher than in the US that has been leading for many weeks, that reported 43,000 cases and so on. So we have a big challenge in South Asia, driven by India, and so on. So the Mekong sub-region, we thought that was because of the policies that they had in place and so on, was more or less like being spared the serious impact of the pandemic. But now the problem started in Vietnam when they opened up domestic tourism, and people started traveling across Vietnam and so on. And now we are seeing serious problems. So I think that is very, and of course, in Australia and New Zealand, they were actually discussing in the month of June to have what is the Trans-Pacific bubble, the yes. Travel between Australia and New Zealand, and that because the countries had the virus under check, there were no restrictions required and so on. And then the problem started in Melbourne. So it's almost impossible to predict that which region is actually out of this, and it's just a matter of looking at how the regional approach and regional collaboration and cooperation, we can all share information.
And I agree, there are lots of moving parts to this situation, and it evolves every day. Yes, I did put you on a bit of a spot on with that question, but that's something on everybody's mind, But the situation changes every day. Finally, this is my final question: is there's always a silver lining to every crisis, even though it is hard to believe that there could be one from this monstrosity of a pandemic. What are the opportunities that will arise from the current situation, from your estimate?
I think that as a development organization, when we look at this crisis, there are many opportunities that are going to arise. For example, in the education sector, in many countries, there was underinvestment in terms of technology. The internet connectivity in many settings was not fairly advanced. In some of our larger countries, for example, in Pakistan, with more than 220 million people, the internet connectivity is just about 18%. In Bangladesh, another large population of over 160 million people, connectivity just about 16%. And so out of this, countries are realizing that the internet connectivity should be prioritized similar to, for example, other infrastructure like roads, railways, and so on. Because you need it for e-commerce, you need it for education, you need it for transport, you need it for a variety of things. So I think that the realization of the increased financing for internet connectivity is quite central, and that is going to transform, of course, the entire economy, because once people are all connected, there are many business opportunities that arise. The second part is that in the health sector, because many people are afraid to go to hospitals and so on, it's been a lot of technology. How can doctors continue to engage with their patients without actually going to a health facility? Because a lot of people are scared that if you go to a health facility, you might get COVID. So in many situations, hospitals are half empty. But that does not mean that the people are not talking to their doctors, their nurses, and so on. So these are lots of innovation that has taken place in that regard to ensure that health services and health advice is continue to be provided, and so on. And then I find that myself, as the chief of health here, I am collaborating and talking to many people that I would never have talked to before across various sectors to try and come up with solutions to some of the problems. What are the issues that we deal with? For example, in the technology sector, who are the best people that we can deal with in terms of bringing us the best technology? We are doing hackathons and coming up with many innovations that would not have happened. So I think that COVID has just realized that we are all intertwined, and that a country's development is interlinked, interrelated, and that the public sector, the private sector, we all need each other to be able to succeed. Because if there's a lockdown, all sectors are affected. So the solution also has to come from strategic sectors and the related sectors to ensure that this problem does not exist. So I think all in all, despite the massive challenges that we faced, the serious economic loss, and the human suffering, and also the loss of human lives, I think that now going forward is basically looking at how do you do things differently from the past, and how can we be vigilant to ensure that this health issue is confronted. Because you can also borrow lessons from other sectors. For instance, in the agricultural sector, they have very good early warning systems for drought, for hurricanes, and for a variety of other things. And it's thinking about how can we have early warning signs for pandemics, so that we are not caught off guard the way we were caught off guard this time around.
Thank you so much. I really appreciate this message of hope to me. In conclusion, It's clear to me that Asian Development Bank's convening power to bring together Asia's private sector and ministries of transport, interior, health, immigration, finance, tourism is what its member countries need to overcome this crisis. Strong community engagement and risk communication should keep the public engaged and adherent to public health measures for organizations such as you've said, Asian Development Bank and World Tourism Forum Institute must stand together to pivot and work towards a promise of healing our world through the balm of travel and tourism. Thank you, Dr. Patrick, for sharing your invaluable thoughts.
Thank you very much.